Welcome back. Menopause does not require medical treatment, and many women can manage the symptoms without therapy or medications. But all women experience menopause differently, and there are times when hot flashes and other symptoms become more than a woman can manage on her own. But how do you know what treatment is right for you? Dr. McMahon and Dr. O'Leary are still with us. Okay, so let's talk about some solutions. So when we talk about hormone therapy, Dr. McMahon, what do we mean? What is it?
Hormone therapy or estrogen replacement therapy, or there's a lot of different names for it, but the idea, the thing that you're lacking most in menopause is estrogen. And with the lack of estrogen, you get all of the different symptoms, whether it's the hot flushes or the vaginal dryness or whatever that can be occurring. And it's true that most women, or many women, don't need any type of hormone therapy. That's absolutely true. And there's a lot of scares about the possibility of other side effects caused by the estrogen therapy. But what hormone therapy is it can be a combination of a vaginal estrogen cream, it can be an estrogen and possibly progesterone pill that people can take, or it can be a patch. I guess there's some creams and things that are used by a lot of naturopathic physicians that can potentially help. But it's really supplementing with estrogen and then at times also using progesterone to protect the uterus from developing other problems, specifically cancer of the uterus. If people have a uterus and they are taking estrogen, they really need to take progesterone as well. And if they don't have a uterus, they can just take estrogen if they take it parenterally or orally or topically with a patch.
So what are the benefits of hormone therapy?
The biggest benefits, I think, are really hot flushes, vaginal dryness. It can help both of those. It can also help with osteoporosis-related bone thinning problems. Frequently, people's mood, they just feel better when they take it. They feel younger. They just like the way they feel.
But I've read about risks of hormone replacement therapy as well. So can you talk to us about the risks?
Sure. The biggest risk for, again, people that take estrogen alone is that they can develop cancer of the uterus if they have one. If they don't have a cancer or don't have a uterus, then it's pretty hard to get cancer of the uterus, so you don't have to worry about that. So that's the biggest risk. People also are concerned specifically about breast cancer, heart disease, and or strokes. And the best data that we have for the last 17, 18 years would say that estrogen by itself does not increase the risk of breast cancer, heart attacks, and strokes at all. And that estrogen and progesterone together actually do increase it slightly, like 0.07 to 0.08% per year. So there is an increase, although it's small.
How does a woman know if hormone replacement is the right option for her?
She really needs to just talk about different options and different risks and see what she's comfortable with and how bad that symptoms are affecting her life.
So for women who opt for that hormone therapy, are there ways to reduce those risks?
Certainly if people are in better physical condition, that helps. If they can manage their weight, that helps. If they can get adequate sleep, that helps. If they're careful with when they would do a sauna, I wouldn't do it before I went to bed because you're probably going to be hotter. I mean, there's different, open the window. I mean, there's a lot of different things that can help with the hot flushes. Mm-hmm. Anxiety can do that too. There's other medical therapy that can potentially help with hot flushes as well if people can't take estrogen because they've had breast cancer or uterine cancer.
Mm-hmm. So any final thoughts or words for our viewers about hormone replacement?
I think the final thoughts would be, it's really individual. And if you have a question, please talk to your healthcare provider. And if you don't get the answer that you are looking for, don't get all the information that you do, keep asking, or that you want, keep asking. I think it's really such an individual thing that many women go through menopause and go through the postmenopausal years without needing any type of further therapy. And there's other people that really find that the symptoms are bothersome and interrupting their life, and they want to try to treat them.
Thank you. So let's switch gears and we'll talk to Dr. O'Leary about what are some other treatment options that women might want to consider as well.
For other treatments, you could consider depending on their symptoms. So again, like Dr. McMahon had said, specifically if the hot flashes, maybe the vaginal symptoms are the most significant, estrogen replacement is probably the best thing for them if that is the most concerning symptom. But treating specific to the other symptoms of menopause, so say a woman has low bone mass or osteoporosis, you could consider medications to strengthen the bones that are not estrogen, progesterone treatments. Again, he talked about mood symptoms of menopause, depression, anxiety, treating those with sometimes anti-anxiety or antidepressant medications. There actually is one on the market that has shown to decrease hot flashes as well. A certain blood pressure medication can help decrease those hot flashes as well. So there are a multitude of things that we have that can be tried if a woman wants.
Okay, all right. It's time for another break, so we're going to pause here. When we come back, we'll talk about how menopause puts women at greater risk for multiple conditions and health issues, and how to counteract those risks and issues. Stay with us.